Someone you know was sick in late December, January, or even February. You may be wondering right now if you already had coronavirus. Channel 3's Dennis House asked a doctor from Yale about that.
There are reports that coronavirus may have been in the U.S. as early as the fall. Joining us now with more is Dr. Albert Ko. He is a professor of epidemiology at Yale School of Medicine. Dr. Ko, thanks for being with us today.
Thank you very much.
So we've heard this. Is it true that coronavirus has been around longer than we previously thought?
No, I think, from what we know from the epidemiological evidence is that the virus, the outbreak started in Wuhan, China. That's back in November, in December. We've had the first cases, in the United States occurring in January, with people who are traveling. And, that, of course, is that number of cases have exploded because of the global pandemic. But prior to that, there's really no good evidence that we've had coronavirus circulating before, the January.
So I know some people who are saying, oh, I had a really bad cold in January, late December. I wonder, could it have been coronavirus? But they obviously recovered from it completely. Is there any way to tell if you did have it?
So I think the important thing to know is that coronavirus, like many other respiratory infections, can be a cause of pneumonia or the infection of the lung. And also in the beginning stages of the disease, it can actually mimic what we see with influenza and the common cold, other types of diseases caused by respiratory pathogens. So it's very easy to confuse, not only for patients in the community, but also for clinicians to confuse those two, these different syndromes. That doesn't mean that somebody who's gotten a cold or gotten a pneumonia got coronavirus.
We interviewed somebody a while back from New York who had coronavirus, and he recovered. And today was his first day being allowed back outside. His quarantine apparently is over. Is he now immune?
So that's a big open question. I think from what we know now is that there haven't been well-documented cases of people being reinfected with coronavirus. So the assumption is, or the premise is that people are developing immunity after they've been infected. However, the big question is for how long they have that immunity, and also if that immunity is 100% or if it's just partial.
What do you make of one of the reports out there that says if you have type O blood, you are less susceptible to coronavirus? Do you believe that?
I don't know. I haven't seen any evidence in the published literature, scientific literature at this moment, so I can't really comment on that.
Dr. Albert Ko from the Yale School of Medicine, we thank you so much for being with us today, sir.
Okay. Thank you very much for the invitation.
Thank you.
Take care.